Hello, my name is Kelly Brotman, Executive Director of Healthy Community Brookfield, and today, August 19th, 2019, I will be presenting to the Board of Directors the present state of the Healthy Community Brookfield organization, as well as goals for the future and just how we plan to proceed to go forward with HCB. The goals for the presentation are to identify the current state of Healthy Community Brookfield, determine areas of strength, weakness, opportunities, and threats, outline a 3 to 5 year strategic plan, identify key actions for components of the strategic plan, outline evaluation criteria to determine effectiveness of the strategic plan, and to determine the role of the Board of Directors as HCB moves forward. So what is Healthy Community Brookfield? The organization overview is that it began as a branch of the Visiting Nurse Association and was able to develop into its own organization in 1998 after a private donation. The organization really started to evolve in 2008. There were staffing changes, such as the implementation of a chief financial officer, and strategic plans were implemented, and the organization began to engage in contracts with the local health department. The programs and services we offer are varied and numerous, so just to highlight a few are the prenatal and newborn care services, smoking cessation classes, and the immunization program. The environment surrounding the organization is that the community expectations are very vague. The community actually doesn't know what to expect. Community members are unsure of the role of Healthy Community Brookfield. The relationship with the community, however, is very positive. HCB is viewed as being very dedicated and hardworking. The economy surrounding the organization is a little limited. The town public health resources are limited, and due to a current water testing program that required the investment of some expensive equipment, the agricultural community is actually a little financially stressed as of right now. The politics are fairly mild, but there is a rift developing. A number of board members and staff, senior staff, they have opposing views as to how to acquire funds. So that is something we hope to resolve in the future by developing a very specific protocol on how to acquire funds. The strengths, weaknesses, opportunities, and threats analysis is first we focus on internal to the organization, the strengths and weaknesses of HCB. So the strengths, our first one is that we have a number of board members that have up to 15 years of experience with the organization. So that background knowledge of HCB is going to be pivotal moving forward. We have a large staff that's very varied, 97, so almost 100 people, directors, managers, medical personnel, community health outreach workers, and the list goes on. We have quality improvement protocols in place so that when we implement accreditation criteria, this will go smoothly. However, one major weakness is we failed accreditation, so we need to meet those criteria soon. And as I mentioned, board members and senior staff members apply for grants and funding without much scrutiny, so it's starting to really stress the already limited resources of the town health department. For reasons unknown, employees perceive a hierarchy of personnel. They deem medical staff as being the most important, despite nothing in our mission, vision, or handbook that would indicate as such. And more worrisome is that the organization's staff is unclear of our mission and vision. External to the organization is opportunities and threats. Our opportunities, as I mentioned earlier, we are viewed positively by the community and our staff is viewed as dedicated. We have a number of programs that we offer that are actually already offered in the community. So we will be able to terminate these programs without depriving the community of these services. And because they're duplicates and we can eliminate them, we will be able to reallocate funding to other sections of the organization. And because we already have a number of programs in the community, we have established a number of relationships with key stakeholders and community members. And we do have the opportunity to rectify the criteria needed for accreditation. Our current threats is that our funding is scheduled to end soon. The town health department made it very clear that if we do not pass accreditation, our contract with them will be terminated and thus our funding. And key stakeholders question some of our programs and tactics, and this is in part due to the duplication of programs that I just touched upon. And as I mentioned earlier, community members are confused as to our role. So hopefully by going over our vision and mission with the staff and consolidating some of our programs, this will help to clear some of this confusion with community members. And the state-sponsored public health infrastructure is minimal. Local health department struggles with resources, and that's another major threat, is that because of their limited resources, we have limited resources. So to move on to the current mission and vision, because that's something we do need to review with the staff, the current mission, as a nonprofit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. The revised mission is proposed to be Healthy Community Brookfield strives to strengthen and empower the Brookfield community members by providing preventative health services and health education opportunities that are needed in their everyday lives. And the reason for this is that a good mission statement should be brief and concise and identify the purpose of the organization, as well as the actions by which it accomplishes these goals and the targeted audience of the organization's efforts. So, likewise, the current vision states, as a nonprofit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. The proposed revision will read, Healthy Community Brookfield aims to create a society wherein community members feel confident of their health choices. Brookfield residents will know how to make healthy decisions and feel comfortable seeking assistance for services they cannot perform on their own. And the reason for this change is that the vision statement should go further than the mission statement in that it clarifies what will occur as a result of the organization's actions and interventions. So, moving on to the 5-year strategic plan, we will introduce quality improvement and other criteria necessary for accreditation. That's priority number 1. We will be implementing professional development for staff in order to unify roles and visions. And this is introducing the concept that money capital is easy for people to see in terms of gains to an organization, but we're also interested in human capital, which encompasses a number of things. There's no set definition, but it includes employee skills, professionalism, motivation, commitment to learning, productivity, etc., that overall contribute to the success of the organization. We will be consolidating existing programs based on community need, and this is extremely important because community involvement has been shown to be unparalleled in determining the success of a program, regardless of how well planned out the program is and how well funded it is. We really need the community support. And because our overarching goal is for community members to make healthy decisions, we want to be able to develop educational standards for these community members so they can see their progress and know if they've been successful. And we want to know if they've been successful. So the action plan, this table's a little busy, but just to go over the top row, our action of introducing criteria necessary for accreditation is our primary tactic will be to restructure responsibilities and create a unique quality improvement role. So either director of quality improvement or quality improvement officer. The people that will be necessary for this to occur, first and foremost, is our director of nursing, and this is because as of right now, the director of nursing is also serving as the director of quality improvement, so they're multitasking right now. We need involvement from the chief financial officer to know what our budget is in terms of pay for project overtime, and we also need the department managers to all be on board so that they can restructure their regular workflow and determine how they can move around responsibilities to make room for a new staff member. We're estimating this to take roughly 6 months. So 3 months to restructure the responsibilities and create the role of the quality improvement officer, and another 3 months to actually implement the quality improvement. The resources we foresee are the budget for a new role and the overtime project pay that staff will inevitably be needing due to this additional task of restructuring responsibilities. The main barrier is that staff might be reluctant to move their tasks around because they already have a set regular workflow. And to move on to the next action, professional development for staff, is we're hoping to have staff meetings every week and annual or biannual professional development workshops for the entire organization. As for the weekly meetings, this is going to be based on the department managers and encompass the entire staff. And these weekly meetings, they should just be quick check-ins, 5 to 10 minutes, any news, what's been going on, what people have done well, what still needs work. The resources, because these will be short, quick meetings, will be mostly the space for these meetings to occur. But for the workshops for the organization, we will be needing professional fees for those. And the main barrier will be the staff availability. We need the time for everyone to get together for these meetings. And that's another reason we're hoping for it to only be a couple, 5 or 10 minutes each. So moving on to the next action, we want to consolidate existing programs based on community need. So we will need to outline the programs that are currently being offered by other organizations in the community and other services that are available. We will be needing the town reports to determine the areas of greatest need by the community. So we need representatives from all the different departments as well as community stakeholders. And this is going to take the longest time out of all of our steps. We need to outline all the programs that are in existence. We need to outline the areas of need, and we need to dissolve the current programs that we have and reallocate funding. So we're estimating that the minimum this would take is 8 months, maybe up to a year, depending on how smoothly these steps go. The resources, we will need the reports generated by all the other organizations and town surveys and community member input. And the barrier will be that we need to gain access to all this information. There's going to be a lot of different parts, and tracking it all down is going to be very difficult. And our last action is to develop educational standards for the community to make healthy decisions. So our tactic will be to determine the criteria of success for each program and outline necessary skills in each program. So this is going to be based largely on the community outreach department. So they need to be able to be in touch with the community members and see what skills they feel comfortable have been developed and what need to be developed as well. And this is going to take a few months per program. The main resource will be the coordinator from the programs. And the main barrier will be the inability to link specific skills to healthy decision making. So just because someone can do something doesn't mean you can necessarily list all the steps that happened before it. So that is going to be something we'll have to work through as it comes up. In order to evaluate the success of these steps, our key performance indicators will be that we have tasks outlined for quality improvement, we maintain our accreditation, our staff is meeting weekly, and we should have notes that document this. So these notes should be archived for someone to be able to refer back to if necessary. Programs will be outlined based on current availability in the community, identified by need, and each program will have goals to identify success and a list of skills that can be learned in order to reach said goals. So just to summarize and to involve the directors, by restructuring Healthy Community Brookfield, our mission and vision, staff will be reoriented to working towards clearly defined goals. Organization of staff will lead to a better ability to redefine responsibilities and tasks, thus passing accreditation and becoming more reliable of a resource in the eyes of community members. Board of directors will be needed to catalyze main steps of progress, especially staff retraining and organization, because encouraging staff on all levels is essential, as bottom-up approaches are demonstrably more successful than top-down.